So let me just get started with introducing our next speaker. Pancho Argüelles is a community organizer and popular educator, author, and current executive director of Living Hope Wheelchair Association, an organization of migrants with spinal cord injuries. He's worked for the last 30 years as a human rights issues in Mexico, Central America, and the United States. And in Houston, he co-founded Fe y Justicia Worker Center, which is a community organization for low-wage immigrant workers. He's co-authored an award-winning popular education curriculum called Bridge, Building a Race and Immigration Dialogue in a Global Economy, which promotes alliance building and has transformed organizing and empowerment in the growing immigrant rights movement. And so and as I mentioned, he's the executive director of Living Hope, which is an independent nonprofit organization founded by and for people with spinal cord injuries, as well as with other disabilities, so that they can lead full and productive lives. The majority of their members are not entitled to benefits, they don't have medical insurance, and don't have a stable source of income. So Living Hope provides services to the members and helps engage in community advocacy to achieve their goals. So Pancho is in Texas right now. And couldn't be here today, but we're very excited he can be here on Skype to talk with folks.
All right, you're on.
Okay. Yes, as you were just told, I work with a group called Living Hope Wheelchair Association. The plan was to have two of our leaders with us today, but we had some big storms coming through Houston today, and we didn't want to risk it for them to cross all town to come to the part of town where I live. And that actually got me thinking that when the risk that we ask people to take to be part of our work and campaign really speaks a lot of the different levels of privilege and marginalization that we face. And that has to do with the issues that we're being, there you are. Okay, it's okay. I had a glimpse of the people in the room. That's all I needed. Yes, I saw the smile. I'm going to quickly go through. So, now, can you still hear me?
Yes.
Okay, so I was saying how this idea that I told our board treasurer Francisco Cedillo and our secretary Raimundo Mendoza, who are both a part of the board, but also they are basically the volunteers that run our organization, they and some of the other leaders. I told them, don't risk it, don't cross town in the middle of the rain, let's just do this. I was thinking also how when we talk risk, it's where a lot of times privilege becomes more evident, because for me to get out in the car in the middle of the rain, well, I might get stuck in the rain, but I don't have the risk that if the police come, instead of helping me, they might decide to take me to jail because I don't have an ID, and then once in jail, they might decide to call immigration and then I get deported. And if I get deported and my kids are here, then the risk is that I'm going to try to come back to them and I could die in the desert trying to do that. So that was really kind of sobering and connecting it to the issues that Betsy was talking about, no? Sometimes when I talk about Living Hope, I say that in some way I work for an organization that shouldn't exist. Because the way Living Hope was born was 10 years ago. We are going to celebrate our 10-year anniversary in the next 2 months. Yay! We will save you some cake. So the group was born 10 years ago when the Harris County Hospital District decided to stop providing basic medical supplies to people with spinal cord injury who didn't qualify for Medicaid, Medicare, basically who were non-eligible, who were undocumented immigrants. So suddenly you had a group of workers who were injured in workplace accidents that you know have a very high prevalence among Latino workers, or in car accidents, or who were victims of crime, and they were told, sorry, you don't qualify, good luck, here are some catheters, and the next month, well, it's on you, see what you do. And these people being part of my people, and the same way that many communities, they came together. They started wielding a net of solidarity and action. They started selling roses on the street in the heat of Houston, or doing raffles in churches, and getting the money together and buying some catheters and diapers that they will share. So this was 10 years ago. Now, 10 years later, we're a small nonprofit. We have nonprofit status. We don't have paid staff, but we are volunteers that every month we distribute supplies for anyone who has a spinal cord injury in Houston and needs them, even if they are legal permanent residents or citizens. Sometimes we get people who actually have access to some supplies through the medical system, but they don't get enough. But mostly we provide to undocumented immigrants. Every month we are distributing those catheters and diapers that people need, no? But in a city that has the largest medical center in the world, a group like this shouldn't exist. And so Living Hope speaks not only of the resilience and generosity and power of the spirit of these people of Noel, Cedillo, Raimundo, and so many others. We have like 50 members plus their families and solidarity. It speaks about the beauty and the resiliency of this community. It also speaks of a society that is really sick, a democracy that is in serious trouble. The levels of inequality that we are seeing in the United States, the levels of racially based violence that Betsy was describing and that gave rise to the Black Lives Matter movement, and that every day we get this reminder of how dangerous it is to be a black person in the United States. Those elements speak of a society that it's really sick. Therefore, conferences like this, campaigns like this, movements like this that are taking a basic human right like health and pushing it forward are not only working to win the issue, but they are also working to save the basic institutions of democracy of the country, and also to keep the spirit of this nation healthier. And this nation needs that because, as Betsy was talking about, the roots of this nation are connected to brutal acts of violence and dispossession of people of color through slavery, through colonization, and one of the expressions today is through repression and marginalization of immigrant communities. So it's like a sobering scenario in terms of what we're dealing with. I tell people that politicians like to talk about the debate, the healthcare debate, or the immigration debate, and how you are part of the communities who's paying the consequences of an unfair system. It's not a debate, it's a battle. Because we're seeing the bodies, we're putting the dead. And literally here in Texas, we are sometimes actually looking at the body bag. No? My wife works in a project that is working to try to identify immigrants who die in the desert when trying to cross the border and who are buried without proper identification. So they're never found by their families. So we're facing a system that is not only denying the right to a dignified life, a healthy life, access to health care, but even sometimes the right to a dignified death. And that says a lot about the system, not necessarily about us. One of the things I was thinking and preparing for this presentation is that at the bottom of all these policies of exclusion and access to services, that you all know a lot about that, probably even more than me, there seems to be this belief or this foundational notion that not all suffering is created equal. That there are things that can wait. And so one of our members can't go to the emergency room because he has no access to Medicaid, to to the whole holistic management that an injury like the one he has, a spinal cord injury, is almost quadriplegic. So he doesn't have access to the good care, so he has to go to the emergency. And recently, you went to the emergency. Hello? Okay, so you're saying that I was telling the story of how one of our leaders, he recently had to spend 16 hours sitting on his wheelchair in the emergency room. He wasn't even offered a bed where he could rest for a little while to be seen. And behind that, we see a health system that is very inefficient, that's more expensive than a lot of the other ways of treating it. We see a democracy that allows for that to happen, but also there seems to be this bottom rock belief that his suffering is less urgent than other suffering. So what can we do very quickly? Again, it's sobering, it's sad, but I think we can continue working not only to win a campaign when we win a policy, but also in fighting for the policy, we are able to build a movement that is not trapped in only one issue, but has the capacity to go across issues. And thinking about how we look at the face of our privileges and differences, we need to be able to be intentional allies. So that when people who have more privilege and power come to work with communities who are marginalized, you are not intentional in being an ally. It's not going to happen by accident. Oppression sometimes might happen by accident, but being an intentional ally doesn't happen by accident. And that means shifting, challenging our roles. It's not about going out there to those communities to educate them in their rights, but actually to accompany a process of empowerment. When those who are paying the price and taking the risk of an unfair system are also taking a leadership role defining the strategy. So I know that's my time. Thanks again for maybe visit our webpage, see what we're doing for our anniversary, and I know I might stay if there are questions, but
we wanted to give as much time as possible to our panelists to speak today. I know this is a big topic and people probably have questions. We have time for just a couple questions, and please make sure they're questions. You know who you are. So if anyone has questions, Ben is right here. Raise your hand, and we have time for about 2 or 3 quick questions. Then we got a movie.
Thank you. My name is Teresa Mosqueda from the Washington State Labor Council, AFL-CIO, and my first question is for the first speaker. Thank you so much for your presentation and for the earlier workshop that we went to. Just wondered if you could share with us some tools that we can take back to our state. Now that you've covered undocumented children, which Washington State has also done, we want to cover everyone in Washington State, and we want to know if you have specific tools or policy ideas, or even, for example, waiver vehicles to do that. What is the tangible takeaway that we can take back to our state to begin to follow your lead in that effort?
Yeah, I mean, I can mention our work next year is to be able to cover adults. We do have a legislative vehicle for that already in our legislative cycle that's going to start next year. We want to be able to expand our Medicaid program to low-income undocumented people, but for also that for undocumented adults that have higher incomes, we also want to open up the marketplace, and we're doing that through a 1332 waiver as well, and we have a very small window of opportunity to do that. But I guess in terms of like tools and just like some tips, I just want to keep emphasizing we have to make sure that we're working together side by side with the immigrant rights community, and specifically immigrant young people, like the immigrant youth that have been and will be and continue to be at the trench lines doing direct actions and moving legislators to pass immigration reform, but also who were very instrumental in passing DACA, the Deferred Action for Childhood Arrivals. Obviously, there's strategies that we can share and things that have worked that we can be able to share that with other folks as well. So we need to be working with the immigrant rights movement in a meaningful partnership, not just to, like I think Pancho mentioned, not just to come and educate, not just to come and share what the agenda for the single payer movement is, but like how can we work together? How can we share strategies? And what is that vision? What does that look like? What does healthcare look like for everyone moving forward?
Yes, I want to thank Pancho, mil gracias, and Betsy for your talk and your work. My name is Alan Benjamin from the San Francisco Labor Council. We're setting up beginning Monday an Immigrant Workers Justice Center funded through the city and through the National
I can hear you. I can hear you.
Sorry.
So you?
Go ahead. Keep going.
Okay, and my question to you is the following. I know in Los Angeles, a similar worker center has been set up through the Los Angeles Federation of Labor. We're starting one. Is the issue of healthcare been brought to these? Do you know about the project, and are they beginning to work around the issue of healthcare for undocumented immigrants? That's a huge issue for us. We're starting mostly just providing services to people who need documentation, maybe perhaps help them against the deportations. But is the issue of healthcare something that you can help us with? We'd like to work with you around this issue.
Well, yes, I will love to talk with you and collaborate. I'm so happy to hear that you are open in these spaces that make a big difference. Having access to services makes a big difference in people's life. And sometimes when we are organizers and we want structural change and justice, because I have the privilege to have access to services, sometimes I diminish the political importance of services. So I think services are key. And then also intentionally can be the door to go for a service and then receive the service, but also receive the invitation to be part of a process of empowerment and organizing. I think that one question I would like for you and everybody to take with you is to take the question of how do we put on the table the population, not the issue, but the population, the people and their families of undocumented immigrants who suffer injuries that leave them with a disability. When their broken bodies cannot work anymore, if they already were pushed out, and there is this question, like the system doesn't seem to be sure if we are humans or not, like corporations are people, but about those we are not sure. But for each one of you to really ask that question when you go back home, what are the alternatives that a worker has if he suddenly has a spinal cord injury and is in a wheelchair, and what are the networks? I know that the situation in California is going to be a lot better than in Mississippi, Alabama, Texas, or other places, and that's one of the things we want to do at Living Hope. Do what we can to respond. You already heard that we are small and volunteer and all this, but we get to do a lot of stuff, but also the local groups to ask that question. How can I go and meet those who are the more marginalized and then learn from them how we do something about it?
Great. Thank you, everyone. Thanks, presenters.
I think the last thing I'll say is that, my presentation really scratched the surface of talking about racism and discrimination within communities of color and how that has impacted their health, and, impacted their health outcomes. But, I obviously because of time we couldn't go a lot deeper than I wanted to, but I really encourage all of you to have these courageous conversations with your members. Have these courageous conversations with your coworkers, with folks that you're organizing on the ground, because this is needed. This is absolutely needed. We are, like I mentioned, we are talking about an issue that is a matter of life or death. Undocumented people and people of color are dying because they have no access to healthcare, not just in my state of California, but throughout our state. So these issues are really, really important, and I invite you to have these conversations with everyone. And I'm happy to be a resource, and I know that my information will go up if you need to reach out and we can just talk about this a little more. I'm open to that. So I just want to thank our panelists, our wonderful panel tonight, taking on this really difficult and big issue. And I just want to, I know we need to close early, but I just want to kind of leave folks with a few takeaways, because I think this is a challenge that we are presenting to our movement today, right? This is a challenge Betsy's saying next year we need to see a lot more people of color in this room, immigrants, people of color, and how do we do that? How do we start to do that, right? And many of us in this world and other worlds of social justice, we work with lots of diverse communities, and we need to start building those alliances, but it doesn't mean that we tokenize folks, right? We don't bring people in and ask them to be on the panel and tell their story and then say, thank you very much, we'll tell you the next time we need you to talk on a panel. So what does that mean? That means that folks need to be at the table, they need to be part of the strategy, they need to be part of the decision-making piece of your campaign. There needs to be equal power in those relationships for true coalition building to be made. And we can do that, and if you think about it, right, we all have these relationships with organizations that are doing wonderful work in communities of color and immigrant right communities that we can reach out to and start building those bridges, and that's the work that we really need to start doing. And California hasn't figured it all out. You can criticize us in the same way that any other state can be criticized. It's something that we're starting to be much more intentional about, and we're seeing a change because of that. And so all of us, I think, if we are intentional about it, we can build a movement that really incorporates everyone who is impacted by the injustice of our healthcare system. And we have a shared enemy here. We all know that we are all up against the same enemy, and it doesn't make sense for this healthcare justice coalition and movement to be over here while we're over here. We need to come together and build power and be able to unite and win this fight for good and really win true health for all of us. So thank you very much. We look forward to doing this.